Do you consider yourself an evidence-based champion, promoting and adhering to the principles of risk, need, and responsivity? Are you at times frustrated or stuck and wondering if there's more that you can do for your justice-involved clients? Do you love the assessment process but are maybe curious as to how to better link assessment with case management interventions? If you said yes to any of these things, then keep on watching. I'm Joseph Arvidsson, Executive Director of the Paragon Group and host of the Criminologist YouTube channel and the Criminologist podcast. I want to share with you my 30 plus years of experience in corrections and 20 plus years of university level teaching on the topic of corrections and evidence-based practices. Today, we are going to continue to build on some of the themes we established in our previous episodes in this series around desistance. Thus far, we've given an overview of desistance from crime, talked about the critical role that identity plays in the process of desisting from crime, provided some context as to the pathways into as well as the pathways out of crime, noted how we can actually assess where an individual is at on their own trajectory desisting from crime, and recently highlighted some interventions you can utilize to address some of these desistance correlates with your clients. In this episode, we are going to introduce you to and differentiate between a client's risk state and their risk status. First off, I want to acknowledge the work of Dr. Ralph Sarin. Dr. Sarin has done some groundbreaking work around assessments, particularly in the arena of desistance from crime. I consider Ralph to be a mentor and again want to fully acknowledge his development of this material and the concepts you're about to be introduced to. Now, when we think of risk assessment in corrections, we think of a snapshot in time. If you are conducting your assessments annually, which is typical, you get a snapshot of that client's risk status. You interview your client and collect collateral information and crunch the numbers to come up with a score, if you will, and denote that client as either low, medium, or high risk. You case plan or perhaps even surveil accordingly based on that snapshot until you reassess in 1 year's time. If the interventions were successful, you hopefully drop that score a little bit and that client hopefully moves from high to medium to low risk status and then is eventually, perhaps, hopefully, discharged from supervision. And this is how things work when we focus merely on risk status. But as you should all know, if you are correctional practitioners, lots of things can go on in a client's life during the calendar year in between annual criminogenic assessments. Yes, that score of yours is predicting risk of reoffending within the next year, but we know factors such as access to victims or the immediate situation change that risk from day to day. This is where risk state comes into play. Risk state is looking more at the risk of imminent reoffending. Now ask yourselves, what can change for your clients from office visit to office visit, which may spike that risk of reoffending on any given Sunday? It's an American sports reference for you. Allow me to illustrate. Our client, Mascot Josie, is assessed at medium risk to bark. Her assessment predicts she will bark 6 times a day. That is her risk status to bark, medium. So as her owner / probation officer, I would create an anti-barking intervention based on that probability of her barking 6 times a day. But if I looked at more acute variables that prompt her to bark, I could concentrate my anti-barking interventions around those things. Maybe things like hearing strange noises in the house or looking out the window to see somebody else walking their dog, or the motion sensor triggered when cameras detect a car in my driveway. Those things are reflective of her risk state. The problem is my assessment scale only measure the probability of Josie barking in a 24-hour period. Same as your criminogenic assessment only tells you the probability of your clients offending over the course of the next calendar year. Wouldn't it be nice to know more precisely when your clients are at more imminent risk to reoffend, so you could plan your sessions more accordingly, be more targeted with your interventions, as opposed to prepping and conducting your sessions based on that annual snapshot? So rather than utilizing the more precise indicators of when Josie may bark, I have to case plan all day based on her likelihood of barking in a 24-hour period. Let's take a look at how this might look in more of a real-world setting. Your client may report 1 month gainfully employed, sober, in a stable relationship with adequate housing and transportation. But prior to visiting you the following month, that client may get laid off or fired, relapse because of that change in employment status, get into a fight with their partner, break up, and get kicked out of the home. Are your case management strategies so in tune with those types of changes based on your annual assessment that your interventions are going to change that rapidly? Probably not. Or are you going to be aware of just how much more at risk your client is to reoffend based on those changes, those acute circumstances? Again, maybe, maybe not. Dr. Sarin has developed tools which factor in not only those traditional, static, stable, criminogenic variables, but also more acute things like substance abuse, employment, interpersonal relationships, and opportunity and access to victims. Finally, these scales take into account those all-important protective factors. For example, their prosocial identity, how responsive they are to advice, and social support. These tools are not designed to replace, but rather complement your existing actuarial risk tools. I hope this illustration helped not just clarify, but shed light on the importance of differentiating between risk status and risk state. If you have not yet done so, check out our video, Desistance from Crime, Interventions and Tools. We also have an entire series on the topic of desistance from crime for you to check out on our YouTube channel. Hear from me and other subject matter experts to learn more about this fascinating topic. If you wish to learn more as to risk status versus risk state, or the topic of desistance from crime, you may reach me via the Paragon Group, LLC.com, or you can send me an email at thecriminologistpodcast@gmail.com. That's thecriminologistpodcast@gmail.com. We offer training and support with the level of service case management inventory, the DRAER, the dynamic risk assessment for offender reentry, and its prison counterpart, the SDAC 21, stands for Structured Dynamic Assessment for Case Management. If you are intrigued and want to learn even more, please check out our podcast, The Criminologist. In that podcast, I supervise a caseload of fictitious felons, helping them all discover their own pathways towards desistance. The Criminologist podcast is available on all your quality podcast platforms. And be sure to subscribe to this channel as well. Just click on our icon. Thanks for watching.